So how many patients do we have in that breast cancer database now?
Well, we have over 100,000 patients.
Wow, that's awesome, thanks.
Yeah.
Wow, I love the smell of evidence in the morning. Welcome back. So last week I was asking all of you if you were asking or demanding evidence from your doctors after they prescribe a medication that you're going to take for the rest of your life, or ask for evidence when that orthopedic surgeon says he wants to do a knee replacement. Are you asking those doctors how many patients got that treatment, how many had a good outcome, how many had a bad outcome? So instead of relying on evidence, did you rely on opinions and feelings? Did you choose your doctor because you trust them? He's a great doctor, you heard good things about him, or your insurance plan told you to go to that doctor? One day, all of you will realize the power of evidence, and you will say, "Show me the evidence," every time your doctor or another expert gives a claim or a recommendation. And when that day comes, there will be a few companies out there ready to find and deliver that evidence to you. And one of those companies is Dr. Evidence, who you met last week. Dr. Evidence is currently building large databases of evidence for Kaiser, pharmaceutical companies, medical societies such as American Heart Association and IBM Watson. So what is the difference between evidence and opinions?
Well, opinions tell you what might happen, but evidence tells you what did happen.
Evidence is numbers. Opinions are mostly just words. Now let's listen to what opinions sound like.
I definitely would not. So much better than...
My first suggestion is...
It's very important. I think...
Awesome evidence comes from published or unpublished studies, and is chock full of interesting numbers and facts. For example, the number of patients who were given the therapy. 100 patients were given a vaccine compared to 100 patients who were not given a vaccine. How long were the patients followed to see if the medications or the surgery was actually effective and safe? For example, the patients were followed for 6 months, or 1 year, or 5 years. The percentage of patients that were just like you. What percentage of the patients in the study matched your profile? For example, 100% of the patients in the study were female, age 65, and had stage 1 breast cancer with triple negative hormone status. The actual number and percentage of patients who had a good or bad outcome of interest. For example, 70 out of 1,000 patients, or 70% of the patients, survived, or 50 out of 500 patients, or 10% of the patients, experienced acute kidney failure. So what is the perfect recipe for a patient to make an informed decision? Here's what's been proven to work. Review the evidence with your doctor, plus combine it with your personal preferences equals best healthcare.